Today's lecture is about, generally, it's really named COVID-19, which is uh, the era for this period, but it is really about the infectious diseases. In general, as a dentist, we are exposed to be infected from the patient, I mean transmitting the receiving the infection from the patient. At the same time, we can also transmit the infection to the patient. When I say a dentist, I mean all the dental clinic staff. But again, this sentence is about COVID-19, says that we are still in the calm before the storm. So you have to weigh, and you should be the leader, okay? And you have to plan if you haven't done yet, because you are a medical dental staff. بما معنى احنا لازم نكون قياديين في هالمراحل هاي، اوكي؟ يعني احنا برأس القطيع وليس جزء من القطيع. In general, dental clinic is always developing, in a continuous development, if it was material wise or if it was equipment wise, okay? And that depends. So it is not only COVID virus we are exposed to, it's also the acquired immune deficiency virus, it's also the hepatitis B or C or non-B and non-C, and so on, and other type of viruses. So some guidelines we always should think about in our clinic. About COVID, these are just basics that it was announced in the 8th of January 2020 that the novel coronavirus is a causative pathogen that was of infection of COVID-19, and it was announced by the Chinese Center for Disease Control and Prevention. On the same month, for the same year, on the 13th of January, the WHO announced that it's already an outbreak and it is really dangerous for the public health. After that, it was announced that it is the cause for severe acute respiratory syndrome. On February, and it was named by SARS-CoV-2. So on February 26, they recognized that it is well spread to 34 countries, and still we are dealing with that virus. Generally, the transmission started from animal to animal, while the outbreak was there when the transmission started from animal to human. And these are the types: SARS-CoV, MERS-CoV. It is believed that the interpersonal transmission occur mainly when respiratory droplets and a contact transmission. Definitely we are really exposed to the respiratory droplets and even the contact transmission. If we got the disease from a respiratory droplet, so it is a direct transmission. If from contact to the surfaces, so it is the indirect transmission. Mostly the dentist, on the occupational hazards, the dentist is the most dangerous career, and he is the one who will be really exposed, because he works for a long time very close to the patient, because our work is really within a few millimeters inside the patient's mouth. And there is a risk of a fecal oral transmission. The fecal oral transmission, which means that it's from the stool of the patient. And that was recorded in the United States and China. In the United States, there was a research that was done for a patient. He was the first patient of coronavirus, and they were doing all the type of analysis for him, starting from the sputum, the oral mucosa, and everything. They discovered that even in the day 7, the coronavirus in the stool was still viable and really can infect people. But yes, but remember, whatever I said, it's what is well known now. But what will be in tomorrow, we don't know. Because this disease is really developing and it's a new disease. So what I will talk about, these are not a fixed theory. Okay? So they will change everything. Every day they will discover something else, and there is a continuous development in the knowledge about this virus, because research are continuous on this virus. But whatever it is, if the transmission was through aerosols or the vertical transmission from a mother to the newborn baby, it's not really confirmed, because we need time. We need always numbers to prove anything. You need numbers and you need times. Time is, yeah, we need time. So this is the setting, the characteristic setting of a dentist in front of the patient, and the patient, he's opening his mouth, and here you can see the assistant's position. So that's why our dental clinic always needs, and now needs, infection control protocol. And for now, it's about the infection control and dental seating. In our clinic, there is always a risk of nosocomial infection in the dental setting, and that is due to the unique character of the dental procedures, in which we use the air turbine and high-speed turbine, the triple syringe, the ultrasonic scaler. These are always ejecting water, then which is a compressed one with a large number of droplets, and aerosols can be generated. So standard protective measures in daily work, which were well known till now, they are not enough anymore, especially when the patient is in incubation period of the disease. Dental patient who coughs and sneeze, and they receive a dental treatment, and we are using the high speed handpiece or the ultrasonic, so their secretion will be mixed already, saliva, the blood, aerosols, to all surroundings, which means that they will infect, if not the patient, if not the dentist who is treating them, so they will contaminate the surfaces. Even dental apparatus could also be contaminated with various pathogenic microorganisms after use, and they will become exposed to contaminated clinic environment. Infection can also occur through the puncture of sharp instruments we use, okay, especially when they are if the sharp instrument and the direct contact with the oral mucosal membrane and the contaminated hands, all these. Yeah. So this picture can show you how a patient who is sneezing and is coughing, he can contaminate susceptible individuals even in the waiting room. That's why we always advise to have appointment first and to keep half an hour for each patient, so there will be no gush of patient in the waiting room, so they will not be infected. if there is any infection in the area. Droplets, okay, with the aerosols can affect the patient and also can contaminate the surfaces, which can cause indirect transmission of infection to the whole workers in the dental clinic and even the following patient. Now, the advice really is not only to reduce the number of the patient and the contact uh, in the waiting room by having a schedule first and keep half an hour for each patient. It's most advisable to have two doors to the dental clinic, one for the entry, one for the exit, so that there will be the patient enters from one door and he leaves from the other door. So there will be we will reduce the risk of uh, infection transmission. The effective infection control protocol, starting with the hand hygiene, is very important, and it will reduce the risk of the transmission of the microorganism to the patient. Hand hygiene, the gloves, and remember, since this disease can be transmitted from fecal-oral or oral-fecal transmission, so hand hygiene is important. SARS-CoV-2 can persist on surfaces for few hours to up to several days, depending on the surface temperature and the humidity of the environment. And they discovered there's a paper that says that with the room temperature, the virus can survive from 3 hours to 9 days. And in humidity of 50%, it survives better more than a humidity of relative humidity of 30%. So the personal protective equipment, mask, gloves, gowns, goggles, face shield are recommended to protect the skin and mucosa from being infected from a blood or secretion. Definitely blood is not recorded in coronavirus, but it is recorded with acquired immune deficiency, with AIDS. Okay, so even a drop of blood, which is dry, on an instrument for 1 year, if you weight it just with water, the virus will be viable again. Definitely, you have to remember that number of exposures are important. For AIDS, the first exposure for a dentist to a patient having acquired immune deficiency, the susceptibility of probability of being a dentist and infected person is 0.3%, while with COVID virus it is much more faster. Yeah, this is the problem with COVID. It's not that strong virus, but it is really transmitted very fast. And all of you should know that the face mask composed of 3 layers. One layer from outside, it prevents the seepage of any aerosol, okay, to be stick to that layer, and there is a filter layer in the middle, prevent the passage of bacteria, and there is a fabric layer from inside that allow you to breathe. And there is also a nose clip. Different type of masks. We have the N95 that can protect you from microorganism in a percentage of 95, and we have the 3M, which is allowed by the European Society. We have this one also can really help to prevent 90% of the microorganism. It will filter them out. Yes. The respiratory droplets are the main route of transmission. That is why we always should have particular respirators are really recommended. And I really don't know if they are effective or no. Nowadays, you can see different type of tools they are using. Once I've seen a patient, they put a patient in the cage of a glass, and there is an entry for the hand of the patient to work. And I don't think this is convenient for us. We need a free movement, and the patient need to breathe. Sorry. And I've seen also something like a lamp at the top of the head of a dentist, so that can suck all the droplets in the during the procedure. And I really don't know, are these things for marketing? Well, the guidelines for dental clinic in general, the patient, if he's with COVID-19 and having a febrile phase of a disease, he is not recommended to visit a dentist. And we have to add something else, that the secretary, your secretary have to measure the temperature of the patient in the waiting room before being there in your room for treatment. And a questionnaire should be really clever to extract the information out from the patient, because there is some way that you can know what the patient were spending the time for the previous 2 weeks, for example, because the incubation period is 2 weeks. And you have to ask him, was he among different people in a wedding or in a meeting? Was he in contact with somebody who was infected by the virus, and so on. A mouth gargle of chlorhexidine, it was proved that to be not affecting at all. There are some researchers that proves that the COVID virus is vulnerable to oxidation. That's why we use hydrogen peroxide in a percentage of 1%, or we use 0.2% of povian iodine as a mouth gargle to protect ourselves. Again, it will reduce the salivary load of the oral microbes. Lastly, it was announced by Dr. Herb from the United States that molecular iodine with a concentration of 25 part per million for 30 seconds is really effective among rhinovirus and coronavirus. Moreover, that the molecular iodine is transparent and non-toxic, because the povian iodine can really discolor the tooth. So the molecular iodine is really perfect, and nowadays there is a product, a mouth gargle by the name, and a gel by the name of IO mouth gargle. Rubber dam nowadays is really essential to mask the breath of the patient, the saliva, the blood, and everything. But you should use a good evacuator with a regular sucking tool. Sometimes rubber dam is difficult to be used for a patient, especially if they are handicapped or child. So there is some Keriosolve. It's a gel, and it's acidic gel that can really soften the affected dentine by caries and sterilize it from bacteria. Then by hand scaler you can clean the area and restore the tooth. In this way we will reduce the generation as much as possible. Using dental handpiece without anti-retraction function should be prohibited. some some turbines are there, okay, they are cheap turbines. They don't have the anti-retraction valve inside, which means that when you finish the work of a patient, especially if you don't care about the dryness, and some of the fluid from the saliva will enter inside the turbine handpiece. It's exactly like a syringe. A syringe also, when you use an injection, syringe injection, or if you wanna irrigate or inject some fluid out, uh, some you will notice that some of the air, if you were just pushing the material outside, so or if the material, if you push it in a liquid, you can find that some of the liquid will also enter inside the syringe. This is a normal, an action and interaction. So to prevent that, in each handpiece there should be some valve, we call it anti-retraction valve. This is important to protect your patient from contamination. Disinfection, we were using, for your information, I was graduated in 1983. For several years I was working in the college. We were not using the gloves or the mask because everything was calm and fine. And later on, in late 80s, where the AIDS have started, okay, and before that, our sterilizer was the hot air oven was fair enough. Yes, we were sterilizing instrument by hot air oven. Then they found that the hot air oven can only sterilize the exposed surfaces. The internal surfaces will not be affected. So it was advisable by that period to buy the autoclave that sterilize uh, with hot vapor. So the hot vapor can really sterilize the internal part and the external part for each instrument. So the instrument you should arrange them inside pouches, and each pouch have a code, have a chemical material, a marker. While when the color of that marker changes, you know that this instrument was really sterilized when it was inside the. We should think really from now on about the waste of the dental clinic. Anyhow, these are colors, different colors of the recycle boxes, and you can see different colors are used for different things, not all of them in one box. For me, the most important part is the sharp needles and the anesthetic carpools. If you don't have a container for them, if you don't have, use a plastic bottle where you can arrange these things from the opening of the bottle. A big plastic bottle, once it's filled, 3/4 of the bottle is filled, then discard it. That if you don't find the hard box. Okay, since we are always, most of the time, are in quarantine, so there are some herbs that can help us when we are at home. And these herbs, like a ginger, and a ginger we call it zanjabil. Okay, so a root of ginger is really helpful against pain, and that results from swelling and disinfection. Just put the ginger and bite on it till the extract of the ginger, the piece of ginger I mean, will be will be flowing on the affected area. Thymes are good. Thyme are really good to chew it. It has an antifungal property. Turmeric. Turmeric is very good It's a powder, like you can mix it with the water, make a paste, and that paste by a cotton, water cotton with that paste, and you can apply it uh, on the pain, on the tooth or the gum that causes the pain, just like effect. Sack brush, it is very good. You can make a tea out of it, and you can put it in a bag, okay, and place it over the cheek, over the aching area. Mint leaves, by the way, you can even chew it, or sucker goes in a mixture of beaten egg yolk, teaspoon of olive oil, teaspoon of sugar, and then apply it on a sore gum. um, chamomile tea احنا نسميه شاي البابونج. It's also very good and really can reduce, it has an antibacterial activity and it can reduce the bleeding in the bleeding gum. You can put it, you can use the tea, make your tea and apply it then on a sore tooth or outside the cheek in a bag, okay, where you have on the area where you have a, and you can repeat it several times. Gloves is something, glove is something we always use it. It's the original, we use it as an oil. It's really helpful to remember. It's good for the teeth and it's bad for the gum. It's a good analgesia. It has an antibacterial activity and sedative. If you have glove يعني هو القرنفل, you can mix it with vegetable oil, cut it in small pieces, mix it with vegetable oil, use a small piece of cotton, or using the gloves volatile oil also you can put it directly on the tooth for the treatment of aphthous ulcer. Licorice is very nice, احنا نسميه اركسوس. And you have the garlic, which is very really effective in case of toothache, and you can mix it with salt and apply it on the throbbing pain area, or chew a clove of garlic or two. These are the references in case of you need them. And remember that most of the designs in our dental clinic should compose from 3 parts. One of them is for the waiting room, other is for the cleaning room, where the sterilizer, where the stirrer that is used, for the reamers, the autoclave, the ultrasonic are present for cleaning. And the third room is the room where you treat your patients. My last advice is to stay home. We know very well that any infection need a source, which is the patient, need the transmitter. In this case, it is the arousal, and a victim, which is mostly you if you don't care. And always remember that the COVID is not a complete cell, is RNA, and it always looks for a cell to multiply and live. And it is a heavy virus, so it's always there on the surface and the floor. Take care is much more better. Thank you.